Hi Tim, it's Mary. I'm back and I'm going to go ahead and we can remove your IV today, and hopefully you're happy about that. All right, I'm going to go ahead and wash my hands, and we're just going to go ahead and make sure I have the right Tim here. Can you please state your full name and date of birth?
Tim Palmento, 7/10/64.
Wonderful. And that matches my chart here. And you don't have any allergies, correct?
No.
Okay, great. All right. So we get to go ahead and take this out. So you're doing better. So I'm glad we can do that. I'm going to go ahead and just put your side rail down here so I can access your IV here a little better. Okay, great. And I'm going to shut this off. All right. Okay, good. So again, I'm just making sure I check the site before I pull it out, and everything is looking good. It's intact, it stayed in, there's no problems with the site. Wash my hands before I put my gloves on. All right, so Tim, what I'm doing is I'm just gonna remove that IV that's in your arm, and you might feel a little bit of pulling of the tape, but otherwise it should be a fairly painless procedure. So I'm going to go ahead and clamp this tubing first, and I'm just going to start to begin to remove the tape or whatever you have for a secure dressing. Some IV sites do have stat locks, so you would want to remove that first before you pull out your IV. When you are pulling off the IV dressing, you want to make sure that you're pulling it towards the IV and not away from the IV, because it might pull out prematurely and you just want to go up against the grain while you're removing it. I'm going to have a gauze pad ready, because once I remove it, I'm going to put this right over the site. Okay, I'm just going to fold that up a little bit, and I'm going to go ahead and start removing the transparent dressing as I pull upward against the grain of the IV. And then when I'm ready to pull it out, I'm going to tell the patient, okay, I'm just going to remove this. I'm going to inspect the IV catheter, make sure that it is intact. And if it does look like perhaps there might be some drainage on it or pus or something that looks unusual, we'd want to notify the provider and possibly culture that. All right, so I'm just going to hold pressure here for a couple of minutes. And at the same time, I'm going to get my tape ready. All right, Tim, I'm just going to put a little piece of tape on here. All right, so that's all out. And I've already held pressure on there, so we'll just keep the dressing on it for a couple hours and then we'll remove that, okay? So now you can move freely with that arm. How does that feel?
Great.
Good. Okay, I'm just going to go ahead and put your side rail up here again. Make sure your bed is lowered and locked. Is your head in a comfortable position?
Yes.
All right, good. All right. So here's your call light. So I'll give that to you here, and just let me know if you need anything. And I'll be back to check on you in about an hour, okay? All right, and here's your tray table. All right, thank you.